All right,
Yep.
we're ready.
Okay. Welcome to the Joint Conference Committee meeting for Laguna Honda Hospital of November 14th, 2023. Mark, can you call us or can you take the roll?
Yes, I'll start with you, Commissioner Guillermo
Present.
and Commissioner Green.
Present.
I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. We can move on to item 2, the approval of the October 10th, 2023 meeting minutes.
Can you have the minutes before you? Are there any additions or corrections or, okay. Is there public comment?
There is. Let me read something real quickly. For each agenda item, members of the public will have an opportunity to make comment for up to 3 minutes. The public comment process is designed to invite input and feedback from individuals in the community. However, the process does not allow questions to be answered in the meeting or for members of the public to engage in back and forth conversation with the commissioners. The commissioners do consider comments from members of the public when discussing an item and making requests to the DPH. Please note that each individual is allowed one opportunity to speak per agenda item. Individuals may not return more than once to read statements from other individuals unable to attend the meeting. Written public comment may be sent to the Health Commission at the following email address: the word health.commission.dph@sfdph.org. Please note that city policies, along with federal, state, and local law, prohibit discriminatory or harassing conduct against city employees and others during public meetings and will not be tolerated. All right, I see one hand. Everyone gets 3 minutes. Caller, please let us know that you're there.
I am. It's Patrick Manette.
All right. Please begin, Mr. Manette-Shaw.
I remain concerned the minutes still are not clear on the status of hiring Laguna Honda's medical director. In the minutes regarding Laguna Honda's policies and procedures on the consent calendar, I want to report the minutes don't mention that the admission policy you just adopted still wrongly refers to a chief medical officer as having final admission decision approval. CMS CDPH directed Laguna Honda to adopt the SNF naming standards, referring to that position as the quote-unquote medical director, and to stop using the CMO job title as used in acute care hospitals. It will be Laguna Honda's medical director in charge of the 6-bed acute ward and admissions to other SNF units, not a CMO. That policy for admissions still needs to be corrected using SNF appropriate terminology. Thank you.
Thank you. That's the only public comment for this item.
Okay, thank you. Is there a motion to approve?
So moved.
And all in favor?
All in favor? Aye.
Aye.
Okay, great. Thank you so much. The minutes are passed and approved. We can move on to item 3, general public comment. Let me read a quick statement. Members of the public may address the commission on items of interest to the public that are within subject matter jurisdiction of the commission, but are not on this meeting agenda. And then everything else that I read earlier about public comment pertains. Let's see if we've got any folks who would like to make comment on this item. If you'd like to make comment, general public comment, please press *3. I see one hand. Mr. Manette-Shaw, are you there?
Yes, I requested a special accommodation because I had a throat biopsy yesterday and I could not get a reasonable accommodation under the ADA today, which was very disappointing because I've been told not to talk or stress my voice box. This is so disgusting. I'll submit written comments for this item for the minutes.
All right, thank you. That is the only comment, hand that I see for general public comment, so we can move on to the executive team report.
Okay.
Give me a second to pull up the presentation, please. All right.
Good afternoon, commissioners. How are you? Good. I'm happy to present the executive team report, stepping in for Roland this afternoon. Next slide. Recertification status update. Laguna, as you know, Laguna Honda Hospital has submitted all of the milestones for the monitoring survey 3 and also the non-monitoring survey action plans. Action plans are a blueprint for how we will accomplish recertification and also will be the blueprint to how we remain successful over the long term for sustainability. A total of 461 milestones were submitted. The milestones touched on critical areas of the hospital, including abuse and neglect, quality of care, behavioral health, resident rights, and a home-like environment. The QIE, or the Quality Improvement Expert, is reviewing all of the milestones for submissions for final approval. And then following the submission of our application for Medicare recertification in September, we're now subject, as you know, waiting anxiously for our full survey by CMS, which could happen at any time without notice. So we are anxiously awaiting that revisit. Next slide. So, that's preparing for the big one. The Laguna Honda Hospital participated in the Great California Shakeout on October 19th, and it was conducting a facility-wide earthquake response drill. As you may recall, we had major vulnerabilities in our emergency preparedness plan. And you'll recall, commissioners, during the third monitoring survey, there were no findings in our emergency management program. And this is significant improvement. This was our opportunity during this great shakeout to really test our system and process. And during the drill, we tested our communication systems, performed an evacuation, an actual evacuation you can see on the picture using stair chairs, and it set up a medical surge tent. And we just want to take a moment. I wanted to say thank you to all the staff who contributed to the success of this important safety drill. We did earthquake response, we med surge, and then really using our radios and our communication system and really closing the loop on all aspects of our plan. So it was a great success, and thank you to the staff. Next slide. I'm happy to announce that our family council has relaunched and that we're continuing to increase our family engagement. The Laguna Honda Hospital Council returned for its first meeting since COVID-19 pandemic on October 18th. This family council was actually founded in 1990, and the family council serves as a space for families and friends and representatives to come together and support each other and discuss any topics or concerns related to Laguna Honda Hospital and to the care of their loved ones. Families, friends, and representatives organize and they run the family council independent of staff. It's an independent family council. But our staff do provide the support needed, and any leaders that the family would like to address or speak to are invited and can join as guests as directed by the council. The next meeting is scheduled to take place on November 15th. And I'm going to talk a little bit about sustained culture change, but right now I'm going to ask if Jennifer Carton-Wade, who's been leading our change management efforts, can provide an update regarding the progress in the current state.
Commissioners and Sandra, can you hear me okay?
Yes.
Yes.
Oh, fantastic. Wonderful. Nice to see everybody. So Laguna Honda's been on a journey of change management since 2022, May of 2022. Our current state, as you all know, is one of continued evolution, and we've been very fortunate to develop more nimble responses to the new challenges that we have as a part of our recertification, which has been a transformation. And we're looking now at sustaining the gains that we have achieved since the start of our change management and cultural change efforts. Our current focus on cultural change is through the work that we're doing in response to our employee engagement survey. And we've been told in that engagement survey by our Black and African American employees that their work experiences are very different from their white and Asian counterparts. So our plan is to address these differences through the Care Experience team, which includes the Department of Equity and Culture and the Employee Wellness Program. We're going to be focusing on micro trainings about the Respect in the Workplace policy and to reestablish our Employee Wellness Program. Thank you.
Thank you, Jennifer, for leading and co-leading this very important work for Laguna Honda and all of its staff. And I wanted to just add a little bit of, about sustained culture change and on the clinical operations side and some of the systems also that will help is through our interdisciplinary daily stand-up meeting where we meet every day with all of the unit leaders. And they are gives a chance for the line staff to report up any escalations, concerns, ask for help. And we meet with the group of the management team and executive team, and we're able to be nimble and address things in time and really support staff that day and hopefully close it out by 4 o'clock that day. So just an overall communication that gives voice to the staff on the units and also the residents that they care for. Next slide, please. We're pleased to announce the draft annual report for fiscal year 2022-2023. The report outlines the remarkable progress made towards our goal of recertification and also shows the spirit of Laguna Honda Hospital remains intact and that our future remains bright. So I want to just thank you for your review of the annual report. And we really greatly appreciate the feedback and look forward to presenting this report next month. And if you have any questions regarding the report, Naz is available to answer them. No?
Commissioners, would you like to wait until the end of the presentation to make any comments about the report?
Yeah, I thought that we would probably wait for the whole report.
Sounds great. All right. And then admissions, discharges, and expirations. So I can't see the numbers on either slide. Let me see if I can do this. Well, our daily census remains for October of 2023 is an average daily census of 471.9. As you know, new admissions continue to be on hold and will continue to be on hold until after recertification and also after we feel that our improvement measures are sustained. There were a total of 4 planned discharges, 1 unplanned discharges, and 3 expirations, no admissions. Next slide. And that concludes the report. I'll open it up to any questions.
Yeah. Are there any questions from the public?
Yes, there are. Folks on the line, you can press *3 if you'd like to make public comment. I see a couple hands. Let me just make sure I'm seeing everybody. All right, so we'll start with those who've received accommodation. 2 of you have received 2-letter codes, and we'll start with those folks. Mr. Minette-Shaw, you've got 3 minutes.
Thank you. What is taking so long having the Medicare recertification inspection site visit start? Has Laguna Honda gotten more immediate jeopardies about the 3 anonymous complaints during site visits in October that are now under review by CDPH's regional district office? Is that what's delaying starting the Medicare site inspection? At this rate, resumption of admissions are probably still 4 months away, and we'll be lucky to resume before April of 2024, at which point all new admissions will have been stopped for fully 2 years. What is the delay in starting that Medicare site visit since you gained Medi-Cal recertification beginning at the beginning of September? It's now been another 2 months. What is that delay? Why isn't the Health Commission and Supervisor Melgar and Congresswoman Pelosi pushing for getting that site visit started so that admissions can expeditiously resume? This commission needs to take action on getting that inspection started, and you need to get off of your chairs, stomp your feet, and get that done and get it started.
All right, I presume that's the end of his comments. Next caller. Oh, I'm sorry, I've done that again. We have one more caller.
No, you.
Okay, caller, please let us know that you're there.
Hi, it's Dr. Palmer. Can you hear me?
Yes, please begin.
Okay. Yeah, I agree with Mr. Manette-Shaw about the delay in readmissions. This is causing untold suffering, and we need more details about why this is taking so long. And I can't help thinking there are things that you're not telling us about why it's taking so long to turn the ship around and to get these surveyors in. Another comment I'd like to make is it's not, doesn't make me feel good to hear that you've had no family counsel there for so many years. This is a requirement and indicates a real lack of transparency and inclusivity in the culture. Not having a family counsel, it could have been done remotely. There's a lot of ways you can keep families informed and included, and it looks like this is a part of the culture change that really needs to occur and be maintained. Keeping families in the dark is nothing to be proud of. Another question is what happened to the medical director? There was a job offer being made. Why do we not have a medical director yet at Laguna Honda? And why? What happened to the 75 residents who are awaiting discharge to a lower level of care? It sounds like placement is not being found for them, and we need to hear more about that. If there's a continuing lack of services in San Francisco, that will affect Laguna Honda in many different kinds of ways, including undue pressure to admit inappropriate placement because there's no other services in the city. Again, I would also like to hear about what's going on with your plan for behavioral cohorting. The only thing I really got out of your behavioral presentation was that, you know, some robotic animals had been bought for dementia patients, and that's the only intervention I heard about. Have you staffed the BERT team? How's it going with making plans for dealing with behavioral patients and with cohorting? Are beds going to be taken away from San Franciscans that need a nursing home bed to run a mini mental health unit there, or is the city appropriately going to fund beds in another location? We need to know these things. Thank you.
All right, those are the only two hands that we saw. So commissioners, it's your floor.
Okay, thank you. Are there any questions?
So thank you for the report and also for the annual report. I sent some written comments, which I've already gotten responses for, and I appreciate those. I think it's a great report. it summarizes things well. And I think it also is updated from, last year we had probably diagnoses that weren't as accurate as these. So I think this year it gives a much better flavor for who, our residents are. And so encouraging to know that despite all the pressures that have gone on, that, this demonstrates that the spirit of the staff is still, excellent and enthusiastic and committed. So I really appreciate that. I think it would be helpful for us to kind of review this whole issue with CMS and surveyors coming, because if I understand correctly, we have no levers to pull here at all, including, we tried our darndest at the very beginning, at the outset of all of this, to have some of the our very connected politicians intervene in some ways, and that even did not create great results. And so I doubt that surveyors will come out this week unless they like to get stuck in all the traffic. And next week's Thanksgiving. So, it's hard to know when they will be here. And if I understand correctly, hopefully by the end of the year, but they prioritize, and all we can do is ask. Have we, what is our ability to reach out and, try to give them a little nudge?
Right. Thank you for your question. You're correct in that we don't really have any way to know. They are to come unexpected, unannounced, and there's no way for us to really influence when to have them come. What we do and continue to do is let them know we're ready, and, offering the invitation. But after that, it's just a waiting game. And unfortunately, and there's no way for us to be able to push the visit from CMS
Can CDPH?
and CDPH.
So no organization really has that kind of power. We're
no.
really waiting for them
No.
to step forward. And then my understanding, and what I saw from what's been sent around, is that there has been good communication with families and a lot of empathy toward families. There may not have been a council, but it seemed like it was a very organized effort, especially during COVID, when families couldn't visit, and especially as with the uncertainty, that balance between what we don't know and that uncertainty and encouragement, and showing that every effort was being made on behalf of the residents. You being sort of a neutral party, having come on, recently, was that your impression? And are there lessons learned or plans going forward beyond a family council that you feel are needed in order to improve the sense of comfort of families?
So I can't speak to what Laguna Honda Hospital was doing during COVID for the families. Jen probably could, but if I understand the question, is that what have I assessed, and what are we going to be doing moving forward? And so having the family council really be an independent unit that is supported by the staff, but then allow for them to come in a safe place, provide the space to have conversations and be able to discuss concerns, and then request various visitors, whether it be the nursing home administrator, social worker, director of nursing, to come. They'll invite for any issues that that they may bring up. And in my past, that the family council has met independently. They may have an issue they want to talk to us about. They'll invite us to the next forum, family council, and then we would have a conversation, and we would present a plan of action to the family of how we were going to resolve concerns. This will be our second one. We're going towards that process where the families can meet and have the support of the staff. I don't know if Jen wants to add anything for the past, but I think your question was more about what are we doing now and going forward.
And how big is the council, and is there any limitation to the number of family members who can participate? Can they participate remotely? If you can discuss some of that, that would be great. What's your target participation?
Yeah.
And frequency of meetings and things?
Yeah, I can let Jennifer.
Oh, yeah, I'm here. I can answer this question. So last time, our reboot meeting was a tiny but mighty group of about 3 family members. We do have availability for, it's a hybrid meeting. So we are having people patch in, and we also have them meet in our Canaley Center. They are interested in just meeting. I think it was, the first meeting was more around support group. That's what it felt like. And so we did a lot of education around what the group was for. Our former family council was very different, and it was very much structured and run by Laguna Honda staff. And, the regulations are clear on that we're providing the space for the families. We provide an opportunity for them to invite any one of us to the meeting. They can communicate with us in whatever fashion that they want to. So it was really trying to set up how they wanted to run the meeting, how we could support them to be successful. From my estimation, sky's the limit, right? They let us know what they're interested in and what they'd like to do, and we'll have to facilitate that. So I would like to share also that we did have town halls. We had a few family and caregiver town halls. We had them in, I believe, in response to COVID, and we also had one, I believe, around recertification. So we did have a communication, opportunity for a dialogue, let me put it that way, with our families. But the family council just definitely was rebooted, and it's exciting. And it's a great opportunity for us to help support our families and caregivers and the folks that do want to attend. But it's very much open. The people who were there were very passionate. One of them wrote a really fantastic, just absolutely beautiful letter that we sent out to the families. So hopefully this week we'll have more folks joining.
And what are you doing about outreach to get potentially to get more families involved? For example, when you have the resident care conferences, are you giving families any information or inviting them to participate?
We haven't done it at care conferences yet, to my knowledge, but we have our email group. We also have some posters that are around the hospital. There was an idea given about putting the information next to the sign-in books when you have to sign in the hospital. So we really are looking at that sort of targeted outreach, because we know not everybody has email, but we do know everybody has to check into the hospital to put on a mask. So we can put something downstairs. We can also put something where they sign in. So, and also word of mouth. Honestly, word of mouth with the families that do talk to each other, so that but spreading the word in that way.
Great, thank you.
No other questions? I had a couple. So I'm really glad to hear that the participation in the earthquake drill. Well, I was wondering, were any residents involved in the process, or was it purely sort of a staff readiness test?
It was a staff readiness, and I don't know if they used residents for the I think it was staff using the evacuation chairs, but that would be a next step.
Yeah, because I'm just wondering, I mean, it's one thing to have the staff ready, but then for residents to really have a much better idea and practice, I
Right,
guess,
right.
on what they should be doing, particularly given the kinds of residents that we have. And so just would like to hear, I guess, about future opportunities for those kinds of, for that and any other kinds of drills
Yes.
that would involve the participation of the residents
Mhm.
and how that might go.
There are various different drills that are required from our emergency management regulations that would require resident participation.
Okay, great. And then on the annual report, really happy to see the detailed report. And it's actually to me, very well laid out, has really good information on it. I wish we could have had an annual report that said that we were fully recertified. But, and who knows, maybe between now and the final publication, or maybe an addendum, we can have that. And, I mean, I have to say, you know, I know how anxious you all are and how hard it is to stay in the state of readiness, especially when you don't know when it's going to happen. So, I commend, everything that you're doing to stay ready, because particularly given the holidays coming up and all of the other things. You've completed the milestones, you've done all of these things, and it's just hurry up and wait at this point. And I just want, to share with you that we acknowledge that. I don't know what else can be done. It appears that our hands are tied and that there is something other than what we think of as the topmost priority for us going on at CMS or at CDPH that they're not sharing with us. Is that the case? So in any case, I just want to understand how anxious and how difficult this sort of limbo state is going to be, and also encourage continued readiness for everybody that's involved, right? And then I did want to ask if there is any update on the medical director or the CMO position that you might be able to share with us.
Thrilled to be able to say that we've offered a conditional offer and it's been accepted to a medical director. Working through those final stages of the recruitment, someone with extensive background in skilled nursing, and hoping to make that full announcement soon. So,
okay, so
that's exciting.
That would be great news. And in lieu of not being able to know when the Medicare survey is going to happen, to know that we are going to have a medical director in place soon. And I mean, that's just great news. And I can't wait to hear when the final announcement is going to be shared, to hear all about that person that has, did you say accepted?
A conditional offer.
Conditional offer, okay.
Yes. So it's the first step in the process, and then you're finalizing all of that, and then we can make the, when the final offer is signed, then the announcement can come out.
Great, okay.
Be public, yeah.
So congratulations in advance.
We're thrilled.
Okay, great. I don't have any other questions, so we can move on.
Great. And before we do, if I may note to both you two commissioners and the public, there will be no Laguna Honda JCC meeting in December, because the full commission will have its annual Laguna Honda meeting on December 19th, where the annual report will be presented. And so hopefully maybe fingers crossed, we'll have several good announcements happening at that day too. But I wanted to make sure the public knew, and I will of course post that and send that on emails.
Great. Actually, I did have one small comment on the annual report that I forgot to make. The section on the demographics, the resident demographics, the rendering of the colors, I guess, is a little, I don't know, because this is a photocopy as opposed to the final copy. It's really hard to really make a differentiation between the different categories. And so I was just wondering if either because this is a copy versus original, but in any case, if there's anything that can be done to change or to brighten or do something with those colors so there's better differentiation, you could see the demographics better.
Could you give a page number, please, so she could find that?
Okay, it's page 24.
Thank you.
Sandra, I can bring that back. We can adjust that. No problem.
Okay. All right. Thanks, Naz.
Yeah, no problem.
Thank you.
Okay, is it okay to move on, Commissioner?
Yes.
Okay, great. So thank you.
Thank you.
Item 5 is the hiring and vacancy report.
Good afternoon, Commissioners. LHH vacancies moved upwards from the level that we saw last month. The vacancy rate.
I'm sorry, Priya. Is it possible for you to turn on your camera?
I have. I'm sorry.
Let's see, it's not working. And there we go.
Okay.
Thank you.
Good afternoon, Commissioners. The LHH vacancies have edged a little upwards from the levels we saw last month. The vacancy rate rose to 12.2% in October from the 11.1% vacancy rate that we saw in September. We've hired a total of 27 employees between October 1st and October 31st in various classifications and had 2 separations during the same period with no retirements. We continue to prioritize and support with the hiring of the RN class. The vacancy rate continues to stand at 9.09% for the month of October, which translates into 19.5 vacancies. Of these positions, currently we are processing 7 reassignments. We have candidates moving through the interview process in 8 of these positions, and for the rest, we're supporting hiring managers to initiate the hiring process. With regards to nursing managers or the 23-22 class, we're currently in the process of scheduling interviews and selections for the 3 open positions that we have. There are currently 27 openings for the licensed vocational nurses category or the 23-12 class, for which we're currently moving candidates through the selection phase. Human Resources is also continuing to develop the batch hiring program and currently focusing on health worker classes. 2903s are the hospital eligibility workers, and the 2930s and the 2932s are the behavioral health clinician classes, where we see a continuous demand for talent within the department. Currently, the team is supporting with the selection and onboarding of 31 of the 37 Health Worker 1 candidates. The 2587 class or the Health Worker 2 series is currently going through the interview process. HR regularly continues to conduct vacancy meetings with program and hiring managers to review ongoing hiring demands. RN highlights for the last month include 5 2320s and 4 T103s who started last month, 1 nurse manager who started last month. Among the non-RN highlights, we had 1 director of pharmacy and manager 5 hired in the pharmacy department last month. We had 1 senior physician specialist hired last month, and we had the 2 directors of nursing hired last month. Thank you.
Thank you for your report. Are there any public comment?
Yes, I believe there's 2 hands up. Again, folks, we're on item 5. If you'd like to make public comment, please press *3. Mr. Minette-Shaw, you've got 3 minutes.
It's weird that the total number of FTEs has climbed by 13 additional FTEs to a total of 1,484. What job classes were those new 13 positions? Home health aide vacancies and the patient care assistant vacancies have both gone up by a total of 6 additional vacancies in the past month. Why are there more vacancies in those job classes? Are they sick of this extended decertification that's gone on for damn near 2 years? There are also increases in activity therapy vacancies. Why is that happening? And are those vacancies still slowing down resumption of admissions? You shouldn't need to delay admissions because of fewer activity therapists. After all, you're down to only I think 478 total patients. You shouldn't need that many activity therapists with your census continuing to drop, particularly since you've got 75 behavioral health patients still on a fast track for discharge. Resume admissions now. You can do it. You know you can do it. Thank you.
All right, thank you. And that was the only public comment. The other person put their hand down.
Okay, thank you. Are there any additional questions? Yes. Commissioner Green?
Yeah, Thank you very much for the report, and you answered some of the questions I had offline, which I really appreciate. I was wondering if you could give us a sense, often with these reports, we talk about nursing and how we backfill nursing positions with registry. And, we've been able to do that successfully, as has every hospital in the area needed to do that. But when it comes to some of these other positions that are somewhat important, like home health aides, do we have any alternatives? Are we deploying people within the system to modify their jobs? What do you do if what would you do if one of these roles, especially one that is patient directed and patient centric, you're really at a loss to fill the position? That's asking a very large question, I understand, but I'm wondering, are there protocols? Is there a way that you try to manage through, needing, having 21 vacant home health aides or 11 health worker threes, for example?
Thank you, Commissioner. I can probably summarize all of the hiring strategies that we have for the various positions and send back an informed response in a couple of days. Thank you.
Well, I'm just curious, and I wonder the extent to which you have nurse managers and and charge nurses doing a lot of the work. But I'm curious just to better understand some of these things, because obviously we want Laguna to be fully staffed. That's certainly important if we are going to start, readmitting residents, and so it'd be helpful to understand some of this in a more granular way. That was the only question I had.
Okay, thank you. We can move on.
Thank you, Priya. We can
Thank
move
you.
on to item 6, the Regulatory Affairs Report.
Good evening, Commissioners. Geraldine Mariano here, Director of Regulatory Affairs, and I'll be sharing the Regulatory Affairs Report for Laguna Honda Hospital. The report reflects activity for the month of October 2023. Laguna Honda reported 10 facility-reported incidents to CDPH and also received 3 anonymous complaints. Laguna Honda also had 2 unannounced site visits from CDPH in October to investigate facility-reported incident and anonymous complaints. We are still waiting for a recertification survey. Please let me know if you have any question or comments that I can address at this time. Thank you.
Thank you for your report. Are there any public comments?
Yes, I see one hand. Folks, we're on item 6. If you want to press *3, that's the item we're on. Mr. Manette Shaw, you've got 3 minutes.
This regulatory report for November is even more worrisome. The survey update section of the report shows the 3 facility reported incidents were investigated on site in October, involved anonymous complaints that are still under review by CDPH's district office. This is very alarming. Surely, the Health Commission must know and may have discussed in closed session by now if those 3 anonymous complaints, since there was a site visit and presumably an exit interview or exit briefing, whether they involve immediate jeopardy, that may once again be delaying their start of conducting that survey inspection to gain Medicare recertification. You must have some idea from the exit interview just why the district office is having to review those anonymous complaints. Because there have been no new admissions since April of 2022, and perhaps fewer behavioral health residents, the cumulative regulatory affairs reports for January to October 2023 shows a total of 60 5 fewer FRIs in resident to resident, staff to resident, and other to resident abuse FRIs and fiduciary abuse. However, there has been a concomitant offsetting increase of 34 more serious FRIs involving staff to resident neglect, injuries of unknown source, major injuries, disease outbreaks, other adverse events, potential privacy breaches, and an increase of AWOLs, AMAs, unplanned discharges in the rewarding calendar year 2022. And there's still November and December yet to go in 2023. So obviously, the resident census as of October 2023.
Thank you, Mr.
down.
Mitchell. Your time is up. That was the only comment for this item.
Okay, are there any questions from the commission? Okay, thank you for your report. We can move on.
Oh, great. Item 7 is the Laguna Honda Hospital policies.
Good evening, commissioners. Today we have 16 policies. 2 of them are hospital-wide and they're brand new, which are the organ donation policy. That is actually moving from a medical policy, a departmental medical policy, to hospital-wide. And then the other new one is the safe and home-like environment. And there are 8 revisions. The first one is the 2007 against medical advice, 2201 abuse and neglect prevention, 2406 resident and visitor complaints and grievances, 2515 medication administration, 2602 management of dysphagia and aspiration risk, 2702 referral for rehab services, 2706 guidelines for inpatient rehab facility documentation, and 5002 resident trust account. And there is that one deletion from the medical department policies, which is C0103. And there are 2 revisions from nursing. The first one would be 5.0 resident identification and color codes, J1.1 obtaining, handling, and storage of medication and treatments. There are 2 deletions, J1.3 aerosol nebulizer and appendix, and J1.4 installations of the eye, ear, and nose. And the last one is a FNS revision for resident meal services. Open to questions.
Thank you. Are there public comment?
Let's see. Folks, we're on item 7. Please press *3 if you'd like to make comment. I see 1 hand. Mr. Minetshaw, you've got 3 minutes. Hello, Mr. Minetshaw? We're not hearing anything on your end. Are you there? All right, I'm going to mute you and unmute you again, see if it'll work. Are you there, Mr. Minetshaw? Okay, we can move on then. Commissioners, no public comment on this item.
Okay, thank you. We might want to check back again after the, okay. Any additional questions or comments from Commissioner Green?
Yes. Well, first of all, I sent some questions about the policies and I appreciate them. And, I've tried to review the answers. They just came today, but I did have a few questions here. One is that I didn't see anywhere in the documents where it specified that our internal investigations, if there's an abuse allegation against staff, are supposed to be completed within 5 working days. And if I were staff reading these policies and it looked like, if our investigations are like CMS, well, I think it'd go on forever. So I wonder if it isn't worthwhile, so staff understands what the parameters are, to state in the policy, because it sounds like from what I read that it's required that you complete the internal investigation within 5 days, working days, whether that should be incorporated in the policy. I mean, as I say, it's up to you, but I think if I were an employee and I felt like I had been falsely accused, I would really want to know what my parameter is. And that there is an obligation to complete this internal investigation in a timely manner. So that was one thing that I think struck me in.
Commissioner, I'm sorry to interrupt you. Is that policy 2201? I want to make sure that we're identifying.
Yes, it's
Yes, it's
Uh,
2201.
Okay, thank you.
yeah, it's yes. And then going back to against medical advice, I don't know whether that also needs to be tightened up a little bit, because ideally, as you said, before anyone were to leave against medical advice, you would have laid out the parameters and helped them or their representative understand the consequences. But it sounds like when it happens in the heat of the moment, it may be misunderstood or not easily absorbed by someone who's upset or having an issue. So it talks about documentation in the medical record, but I don't know if there's a standard documentation. Whether tightening that up might be of value, especially if somebody on the care team identifies a resident that might be in that category and how you might flag it. And I think those were really the main questions I had. I'm happy with, it's been obviously a lot of excellent work and excellent thinking, especially that's gone into these new policies and the modifications that respond to our surveys and some of the demands of phase 3. So those were the main things that I was wondering about.
Thank you, Commissioner Green. I can help out, Carmen. So for the abuse policy where you referenced the 5 working days, that should be in the table. There is a table within that policy that is a mimic of the requirements within the state operations manual. But I agree with you. We can absolutely call it out in the text as well to make it more clear, and we can, Carmen, just make a policy statement at the top. And we, of course, will adjust as if and when those requirements adjust by CMS as well. In regards to the AMA policy, I think because instances of AMA are so different from one another, it's challenging to be too specific within the policy, if that makes sense. We want to ensure that we are following all the correct procedures and processes, as well as those that are required within the state operations manual, and highlight those within our policy. And we need to be able to respond to each individual situation depending on the resident and what's going on. But I believe Nita is on as well. And if Nita, you want to add anything to that policy, or if I've shared anything incorrectly, please feel free to add.
Yes, no, I thought that the questions that you posed were very insightful, because whenever possible, we're trying to document that counseling in advance of an event, right? So it's while we may, at the time someone leaves against medical advice, put information about our counseling on that form, we're really trying as much as possible to anticipate when someone may be at risk for making that choice, and to document our discussion and really thoughtfully have that discussion with them about the risks that may occur if they were to leave in a manner that was not recommended. And to really say, here are the things we would do to keep you safe if that were to occur, like medication planning or location, housing information. But, again, ideally what we're saying is, for you, the risks would be this, and then doing that in the context of the resident care conference by the entire interdisciplinary team, and also one-on-one with individual members of the team. And we're really trying, whenever possible, not to discharge someone against medical advice unless they've had that advanced counseling, really, because we want to make sure that someone, if they're making a choice like that, has been informed, or their loved one and decision maker, obviously. So with them in partnership. And so I think, like Naz was saying, we work really hard to make sure our documentation is thorough, and that we have good standard work around our documentation. And I think our policy gives us the ability to make sure that we're really tailoring it to an individual to make sure that that person truly understands what's happening, because that may involve other particular things for a given person.
Thank you.
Thank you. I had a question sort of related to that as well, not sort of, but actually related to that same area. It's item 9 in the 2007 against medical advice. The wording says LHH should advise residents of the risk. Given everything that you've said and what you're actually have described, should that read LHH will advise as opposed to should, just to tighten that up and make sure that that is something that's a requirement as you have been describing.
I think we can definitely work on the language to say shall advise when, we'll make every effort to advise when possible. I'm just trying to make room for like the scenarios when a resident just leaves, which is very few and far between, right? But yes, we can adjust that language and we'll work with Carmen and team to get that back to you, something that tightens it a little bit more.
Yeah.
Your
Well,
feedback.
particularly if you're trying to do this when you've identified the possibility of a risk.
Right, in the
Because you're
instance
doing
of
everything in
critical,
advance. And so,
absolutely.
yeah. So it would seem that that's something that, as you've described, you do anyway. Yeah. So, okay, that would be good to see that then tightened up, just because, again, who do you hold responsible if there was an opportunity to do it and it didn't happen? Because it should have happened, but it didn't happen.
Sorry, Commissioner Guillermo. Was number 9. Just want to make sure.
Yeah, item number 9. Yeah. Thank you.
Are those the?
That's it.
Great. And commissioners, this is a action item. This is a recommendation to put these items on the consent calendar for the December 5th meeting. Again, noting for the public that the November 21st meeting has been canceled due to the proximity with holiday. So this will be for the December 5th meeting.
Okay. Then is there a motion to approve?
Yes, I would move to approve these policies with some thought about the AMA policy and also adding the investigatory time for on the abuse side.
Okay, and if we can see those edits prior to the December 5th meeting, then that will be recommended to the full commission.
Great, thank you. And
Okay, second, all those in favor?
Aye.
all right, so they will be put on the consent calendar. Thank you very much. We can move now to a consideration for a closed session.
Okay, is there a motion for a closed session?
So moved.
Second.
Let's see if there's public comment. Yes, there is. Let's see, folks, we're on item 8A. Mr. Burnett Shaw, you've got 3 minutes.
As you go into closed session, if there is a quality improvement report discussion and you know today whether those 3 FRIs being reviewed by the district office involve immediate jeopardies that you may have been notified of during October, during their exit interviews, you should come out of closed session and tell the public the truth for once in your friggin' lives. Thank you.
Okay, that's the only public comment. Now, so consider a consideration for a closed session.
Okay, all those in favor?
Aye.
Aye.
Thank you. Folks in the public, you will not hear or see us while we're in closed session, but we will be back, and the video will record the end of the meeting as well if you don't attend. Everyone else, please give me 30 seconds to take us into the closed session. In open session, please consider motion to disclose or not disclose discussions held in closed session.
Move not to disclose.
Second, all those in favor? Aye.
Aye.
And then a consideration for adjournment.
Move to adjourn.
Second, all those in favor?
Aye.
Aye.
All right.
Okay,
Thank
thank
you, everyone.
One.
Give me 30 seconds.